Welcome to Mello's Minute. So much of testing for dementia is based on changes that are happening to someone. So is it advisable or even practical to get tested before there is an issue? We asked clinical neuropsychologist Dr. Robert Duff of Insight Neuropsychology.
Now, you had talked about kind of getting a foundational level or a baseline level. Is that something you would recommend for anybody, and at a certain age to kind of before there's signs and symptoms? Would that be a good bit of advice?
Yes and no. And unfortunately, we all have insurance to consider, right?
Yeah.
And so the way it works is, in order to be covered by insurance, there needs to be some sort of medical need for it. That medical need could be curiosity on your doctor's part, saying, okay, there's a family history, maybe we're seeing very early signs, and so it's important to check it out. That could be enough. But if it's purely out of curiosity, you're not at that age yet where it's going to start becoming an issue, nothing happened to you, you can still do that, but insurance won't be covering it.
Okay, so
right?
you're paying for it out of pocket.
Which isn't a problem necessarily, but it can be a little bit expensive if you're not getting any coverage for that.
Sure, man, that would be it would be nice to have everybody's baseline, right?
Totally, because that's one of the problems is I have to kind of look at, okay, what career were you in? How far did you go in school? Look at some of these other factors to say, okay, this person probably operated at this baseline, and now with these scores, we can definitely tell there's been a change. The other thing we do is just compare that person to what's normal for somebody of that age. So trying to kind of look at it from different perspectives to see, what the evidence of any sort of change has been.